Hi everyone, today we will explain about cataract. This is eye normal and eye with cataract. What is cataract? A cataract is a clouding of the normally clear lens of your eyes. It is clear lens and cloudy lens of cataract patients. Does everyone get cataracts? The answer is no. Not everyone will develop a visually significant cataract in their lifetime. However, if you have cataract that impair your ability to drive, work, or read, then no treatment other than surgery would be helpful in correcting your vision. First, we will learn about pathophysiology of the condition. Pathophysiology seeks to explain the physiological processes because of which such condition develops and progresses. In other words, pathophysiology defines the functional changes associated resulting from disease or injury.
We must know the pathophysiology of cataract itself. Firstly, the lens is made mostly of water and protein fiber. Opacity occurs when the lens protein, which is crystalline, clumps together. Moreover, ability for lens to refract light reduces, which causes reduced visual acuity. Next, chemical modification of the lens causes it to be thickened and hardened. People with cataract may have the following symptoms. Firstly, painless progressive visual. So the second one is the glare. Glare is the loss of visual performance or discomfort produced by an intensity of light in the visual fields, greater than the intensity of light to which the eyes are adapted. The third one is color halos, and the last one is uniocular diplopia. For the signs of patients who having diagnosed with cataracts will cause opacification of the normally clear lens seen through the pupil. Indistinct on retina examinations, red reflex may be dimmed, no apparent pupillary defects, and myopic shift.
We go to mechanism leading to the signs and symptoms of cataract. Cataract patient can see the brownish image, glare, blurry image, and another vision problems. How it could happen? Let's watch this video.
In the healthy eye, the lens is clear and allows light rays to pass through unobstructed. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it is no longer clearly focused on the retina, causing images to appear hazy or blurred.
For most people with healthy vision, this is what it looks like around a city street. But the scene looks different for people with cataracts. When you have a cataract, the lens of your eye gets cloudy, and that can make your vision blurry. Do you see how there's a brownish tint to the street scene? Having a cataract is like looking through dusty glass. Over time, cataracts can also make seeing colors harder, especially blue and purple. And people with cataracts may be sensitive to bright lights and see glare. Cataracts are common, especially in older adults. The good news is that eye doctors can treat cataracts with surgery, and you can go home the same day.
Among the factors of cataracts are overproduction of oxidants, smoking, medical conditions such as diabetes, and eye trauma. How does all of these factors contribute to the formation of cataracts? Oxidative process increases with age, and in cataractous lenses, concentration of protein is higher, which leads to formation of the cloudiness in eyes. Higher dose of smoke will increase the severity of nuclear opacities because smoke itself contains aromatic compounds that oxidatively modify lenticular components. Well, how about diabetes? How does it contribute to cataracts? If someone doesn't have control over their glucose levels, the sugar levels increases, causing the lens to swell. On the other hand, cataract can form after blunt or penetrating injuries to the eye, which lead to physical damage and discontinuation of eye lens capsule. Inner lens swells with water and denaturation of lens proteins occur. Inner lens will then turn white.
Before we end, you must know that cataract not happen to human only. It also happen to animal. So far, we have learned the sign and systems, mechanism that lead to the sign and system, etiology or risk factor of cataract. We will end this video with cataract surgery. Thank you for watching.
The most common method used for removing cataracts is phacoemulsification. In this procedure, the surgeon looks through an operating microscope and makes 3 small incisions, less than 1 inch long, in or near the cornea. An opening is made through the capsule of the lens, and an ultrasound probe is used to break the cloudy lens into tiny fragments. These fragments are vacuumed out through the incisions. Then, an artificial intraocular lens is inserted. Intraocular lenses, made of plastic, silicone, or acrylic compounds, have no moving parts and last for the remainder of a person's life. Because the incisions are so small, stitches are generally not necessary. Vision often improves, notably, immediately after surgery. Another method for removing cataracts is called the extracapsular technique. In this procedure, the incision made near the cornea is large enough to remove the cataract in one piece. Again, an artificial lens is inserted to replace the natural lens. Recovery from this type of cataract surgery is usually slower. Because the incision is larger, this procedure does require stitches. However, the stitches rarely need to be removed.